My bad. And then I think Ms. Waldron had requested so, and so anyway. Apologize, Mr. Allen. Please proceed.
Thank you very much, members of the committee and Mr. Chair. I know there's been a long hearing, but I have something here that I think is actually very non-controversial, and it would be very beneficial. And I would encourage you to please pay close attention to what the bill is and what my witnesses here in support have to say. I think you'll find that this is something that we can actually all get behind, and it really, really might help to save lives. And it's something small that we can do, but I think it'll have a big impact. So with that, this is AB 2832. Very simply, what it does is it requires Health and Human Service Agency and Department of Public Health to make conspicuous in a clearly identified and appropriate labeled way two federal programs. One is called the Vaccine Adverse Event Reporting System, or VARS, and the other is the National Vaccine Injury Compensation Program, or the VICP. Let me state essentially what the issue is very clearly. If you have had your child immunized or vaccinated, and something happens to your child, immediately after, and you think, well, wait, I'm not sure if this is a normal occurrence or not. Let me go to the web and let me see if I can find some resources on this. If you go to the website of the California Department of Public Health, this is, I actually have a series of pages and clicks. Mr. Chair, would you mind if I just pass up? It just shows the pathway.
Actually, at this point, we're just would appreciate that coming earlier. We were just accepting mock-ups and that sort of thing.
No problem. Let me just, for your benefit, if you have any questions on this, go to the Department of Health's website, our website, and try to find anything that relates to vaccine adverse effects or vaccine injury. And you'll find that you need to get about 6 pages deep, and at the very bottom of the very last page, if you're fortunate enough to find it, you're going to find 2 small links here that are not actually even very clear about these 2 programs. And the difficulty is these are federal programs. These aren't state programs. And one is an informational program that tells what adverse reactions might have been to similar or exactly same vaccinations as your child might have just had. It's a federal information system. The other is a link that will tell you specifically if there is federal compensation that you might be able to use for the medical treatment and care of your child if your child was injured. So again, these are not state programs. And all our bill simply says is we'd like to make these links just slightly more conspicuous. Even if it was just a heading or something like this, as opposed to buried 6 pages deep in a place that no one can ever find. So that is the gist of the bill. And let me tell you just a little bit of the background. People who believe they or their child have been injured by vaccine can file a petition making a claim with one of these links that we just talked about, the VICP, for compensation for medical and other costs for pain and suffering. The problem is that I just showed you that we're 6 pages deep onto the website. The VICP, which is the Vaccine Injury Compensation Program, is a 27-year-old program. The problem is many Americans, even doctors, don't know that it exists. As a matter of fact, the estimates are that only 1 to 10% of all post-vaccination adverse events are actually reported in this federal system. The problem there is if there is an adverse reaction to a vaccine that is not caught in time, more kids are actually vaccinated, and if there's an actual problem here, it's going to be a lot longer before this problem gets discovered. And this would very easily be fixed by this bill. To give you an example, in 1999, this was a success of the VARS system. The U.S. Advisory Committee on Immunization Practices voted to no longer recommend the use of a certain virus called the RotaShield virus. And what it was the RotaShield vaccine was intended to prevent rotavirus gastroenteritis, which was approved for use back in '98. Yet investigations showed that it caused an event called intussusception in some healthy infants younger than 12 months of age. So the decision to stop recommending this RotaShield vaccine was made by the advisory committee because it turns out there's a very serious condition, and the perception was actually the results in the medical community actually found that rehydration, just giving them more water, Pedialyte, whatever it happens to be, can actually fix this much better than the vaccine. These investigations were launched solely because the reporting mechanism that was utilized was VARS. So the system itself works. And we've seen it. There's other examples of it working. The problem is that people don't actually know it's there. This is not a state cost. This is not a state program. It's simply a link on a state website that is very, very difficult to find. So this was actually brought to my attention because I've gotten a bunch of calls from constituents as well as physicians. A couple of my very best friends are physicians. Thanks to them, they've done lots of good work, not only for myself but for lots of other people. And this issue's come to me, and I believe in vaccines. I was vaccinated myself. I'm not sure that this really has anything to do with whether you're for mandated vaccines or against mandated vaccines. What it really has to do with is if there is an adverse event, and there's a federal program that actually is there for the reporting of these reported or is there for the reporting of these adverse events, that we should know about them. Because as a parent, if something happens to your child, you're going to go to the web. You're going to Google, what do I do? Where do I go? Thank you very much. And it shouldn't be 6 pages buried deep within the Department of Health's website to find that. The last point is this. That's about VARS, about VICP. There is a Victims Injury Compensation Fund. You might be surprised to note, I was very surprised to learn that the statute of limitations for compensation from this federal agency is only 2 years for death. And it's not from discovery, it's from the date of the original administration of the vaccination. For injury, it's 3 years. Again, not from discovery, but from the time the child was actually vaccinated. This differs from all other personal injury claims. Personal injury claims, if the child is 18 years or younger, are deferred until their 18th birthday. And then
Point of parliamentary inquiry.
Thank you, Mr. Gomez, please.
How long is the opening statement supposed to last? if not, it's not let's move on to the witnesses and then move on. We appreciate the passion. It's very convincing, but let's move on to the next witness.
I appreciate that, Assemblymember Thurman.
Thank you.
And actually, you nailed it, because that is where I close, which is
Perfect.
Essentially these are just 2 great federal programs. They don't cost us a dime. They're on our website. All the bill asks is they simply are made more conspicuous, even if it's just a small heading.
Thank you. Okay. Witnesses, 3 minutes each, maximum, please.
Chairman Wood and members of the committee, thank you for having me today. My name is Rebecca Estep. I live in Poway, California, with my husband, a law enforcement officer, and a lieutenant colonel in the Marine Corps Reserves, and our 2 teenage sons. In 1998, when our first son was 9 months old, I was not familiar with vaccine injuries until our baby had an adverse reaction to the hepatitis B vaccine. I called the pediatrician's office to report that my son was suddenly very ill with diarrhea, fever, and constant crying. I was told that he had just picked up a bug at the office that morning and not to worry. No record was ever made of this call, and our doctor did not report my son's reaction to the vaccine adverse event reporting system referred to as VAERS. Nor did the doctor tell me that I could file a report on my own. In fact, the doctor never made me aware of the existence of VAERS. Years later, I entered my son's vaccine lot number into the VAERS database. I saw many entries of injuries just like my son's. It was chilling. All I could think of is how I wish I knew about VAERS back then. Before my son turned 3, he was identified as having special needs. Our family worked with a number of specialists to address my son's developmental and medical needs. In spring 2002, a local attorney had contacted one of our doctors. He was looking for children who might have been vaccine injured. At our doctor's recommendation, I contacted the attorney who filed in 2002 my son's vaccine injury compensation claim. Before this attorney and I spoke, I had no idea that the VICP existed. When our claim went in, as a result, like so many other families, we ran into a statute of limitations problem because of a doctor's notation on my son's development in his chart. It was a notation that I had no idea existed, and it made our claim 6 weeks outside of the statute of limitations. I was a guest on Fox News in September 2010 discussing the VICP. After that appearance, I received countless Facebook messages from strangers, parents who wanted to know more information on how to file cases for their child's vaccine injuries. From 2011 to 2014, I worked for a nonprofit that focused solely on legal issues for special needs children. The most common inquiry was how to file a claim in the VICP. In November 2014, the Government Accountability Office issued a report on the VICP acknowledging inadequate public awareness of the program. This is a major problem. This is why AB 2832 is so important. All parents should have an awareness and access to the information on VAERS and the VICP because vaccine injuries do sometimes occur. AB 2832 is a small ask, but it's responsible and necessary legislation. Sadly, it's too late for my son, but I don't want another single family to suffer like mine has. Please vote yes on AB 2832.
Thank you.
Chairman Wood and members of the committee, my name is Amy Mitten-Smith. I live in San Diego, California with my 9-year-old son. I am his primary caregiver, and I am also an advocate for families in the areas of special education and public benefits. In 2013, my son was awarded $55,000 by the Vaccine Injury Compensation Program, or VICP, due to injuries sustained from immunizations he received at his 18-month well baby visit. Within hours, he began to present with side effects matching the manufacturer inserts, and over the course of 8 weeks, these symptoms continued and consisted of, but was not limited to, severe anaphylaxis, seizures, regression in previously acquired developmental skills. He was seen by several specialists and hospitalized during the incident. A lot of it this time was spent trying to rule out a vaccine injury. It was discovered that he had 2 previous adverse reactions from earlier well visits. These were also viable claims, according to our vaccine attorney. Out of the 9 or more doctors who examined and treated my son, 0 reported his reaction to the Vaccine Adverse Events Reporting System, also known as VAERS. When I asked why, many of them didn't know about the program or misunderstood the reporting requirements. I finally had to report the event myself, which is when I learned more about the VICP and eventually obtained an attorney. By then, I had lost critical time, and the statute of limitations ran out on the first 2 reactions because the VICP only allows claims to be filed for injuries within 3 years of the adverse event. This is why my son was only compensated for 1 of 3 separate reactions. Shortly after his 2nd birthday, my son's medical and neurological issues became more evident. He qualified for disability and special education services paid for by both state and federal taxpayer dollars. Due to the small amount he received from VICP, the cascading effects of my son's health and developmental challenges, along with the financial burden of paying for his special needs, falls on the state of California to pay for his lifelong care. This is a direct result of the chain of events I just shared, which impacted the outcome of my son's claims and affected the amount of compensation he received for his needs. While there is an abundance of information which promotes the practice and benefits of vaccinations, there is an extreme lack of information accessible to people regarding the risks and actions to take if a child like mine is harmed. Until this happened to our family, I was not aware that vaccine manufacturers could not be sued and that the VICP was the only means to file a claim for death and injuries by vaccines. Having easier access to VAERS and VICP through the passage of AB 2832 will not only be beneficial for those affected by vaccine injuries, but also benefit parents and medical providers alike in being better informed and properly reporting and filing claims in a timely manner. In addition, the financial burden will be lessened for the state if families are compensated through VICP rather than having California pick up the whole tab. Please vote yes on this bill. Thank you.
Okay, others in support of the bill, please. Just your name and organization, please.
Melanie Cuevas on behalf of Public Health Council in strong support.
Thank you.
Jennifer Alexic from Sierra College Veterans of War Services in support.
Thank you.
Jude Tobat, mother of 4 vaccinated children in California, in strong support.
Thank you.
Aaron Mills, father of 2, in support.
Thank you.
Catherine Mills, mother of 2, in support.
Thank you. Opposition?
Chair and committee members, thank you. My name is Dr. Dean Blumberg. I'm Associate Professor of Pediatric Infectious Diseases. Today I'm here on behalf of the American Academy of Pediatrics in California to testify in opposition. I have 3 brief points that I'd like to make. The first is that the committee analysis specifically notes that the link is on the CDPH website, so that there is no need for this bill. Second is that we feel that the immunization branch and the CDPH provide an excellent job of providing balanced information on their website, and that we think that this information is best led by the public health professionals. And then third, as noted, this is a federal program, and so information is available from other venues in the federal government. And in fact, parents receive information regarding VAERS and VICP every single time their child is vaccinated, as my colleague will talk about from the California Immunization Coalition. So in closing, I'd just like to urge your opposition to this bill on behalf of over 5,000 board-certified pediatricians in California. Thank you.
Good afternoon. My name is Catherine Flores Martin. I'm director for the California Immunization Coalition. And it is completely understandable for parents to have questions about vaccines. And we are here to answer those questions and help make that available to them. We want to make sure parents get the answers they need. We work with physicians, school nurses, community groups, and parents to understand the best way to communicate the answers to these questions. Once in a while, I hear from parents who are unhappy with the information they get from their doctors, and I talk to them and listen, and I say, find another doctor, find a doctor you trust, find a doctor you can work with, and follow their advice. Find someone who will care for your child with you. Those are the doctors we want you to get your information from. And those doctors have the information on vaccine adverse events reporting. They know what to do with situations when a child may have, whether it's a minor reaction or a severe reaction. They know what to do with it. As was mentioned earlier, there have been situations in the past, and this is how we catch them, by having these reports. So doctors are committed to this. Of course, there are cases where they may not, but the majority of doctors do provide that information. We asked the Sergeant at Arms to pass out a copy of a sample vaccine information statement. It is federal law for providers to give this to their patients, and it is on number 5 and 6 on the page there. It talks about what if your child has a serious reaction and what to do about it. So for every vaccine a child receives in 30 different languages plus, this is available and is supposed to be given out at every vaccine interaction. Information about how to report an adverse event is on many of the materials that are provided to parents and patients. And again, doctors are required to report adverse events. Fortunately, serious reactions to vaccines are very rare, and if one occurs, there are systems in place to help support the family. Parents and providers alike are encouraged to support and are encouraged to report any concerns. This information is already on the CDPH website. If you go onto the HHS website, Google immunizations, vaccine reactions, it takes you to this location. We do not see a need for this bill. We feel that it is covered already, and we are in opposition and ask for a no.
Great, thank you. Others in opposition? Seeing none, questions, comments from the committee? Seeing none, thank you, Mr. Allen, for your presentation. Would you like to close?
I would love to close. Thank you very much, Mr. Chair. Guys, I'm absolutely shocked by the testimony I just received. Absolutely shocked. Some of my very best friends are doctors. We all know doctors aren't infallible. But here's the concept. Imagine for a moment if something happened to your child. To your child. The first thing you're going to do is you're going to call the doctor. You're going to look on the web. You're going to try to find out everything you can, just like Rebecca Estep did. She looked, and when she finally knew that there was a resource there that she had never been apprised of, years later when she found it, she found case after case of a certain batch of a vaccine that was given to her child, where there was adverse reactions across the country. And she found that out years later. What if she could have found that out days later? Things might have turned out differently. And so, listen, I believe that there's a multitude of reasons to vaccinate our population. I think this, the benefits far outweigh the adverse circumstances in small populations. However, that said, what we're talking about here is simply making 2 existing federal programs just slightly more conspicuous on our website. That's it. There's no cost to the state to do this. And actually, if you take a look at the cost of the state, it actually might be reduced. Because, for instance, what was just mentioned was, doctors are aware of the VARS system and use it. Well, the estimate is that only 1 to 10% of adverse reactions are actually reported on VARS. So clearly, utilization is nowhere near where it could be or should be. And again, this is a federally administered program. So if there was more utilization of this program, potential future costs that the state might have to bear in terms of health costs would potentially be reduced. So with that, this is a very, very simple ask. Right now, to get this information, you got to go through 6 pages on a website. And if you don't believe me, Google it on your phone right now. Go to the Department of Public Health. And I got to tell you, I had to backwards track this to actually find it. It is very tough to find. So it's just a very simple ask. All we're asking is the Department of Health to make it more conspicuous on their website. And with that, I would ask you to please vote yes on this. There's no cost to us, and the good work that this can do through these federal programs that are already in existence would have saved my 2 witnesses' children here potentially from harm and allow them increased compensation that was already allowed to them through the federal government, not through the state. Thank you.
Thank you very much for your presentation, and I appreciate the intent of what you're trying to do to make sure that Californians have readily available information regarding their healthcare decisions. However, as you have heard, DPH already posts the requested information. It may not be as accessible as you'd like it to be, and that's certainly an inquiry and request we could make. I'm not sure we need to legislate that, quite frankly. Additionally, a federal law requires that patients are provided with a vaccine information statement, a document that explains both the benefits and the risks of a vaccine and includes the information for VICP and VAERS. So they get that. They're supposed to get that when they get the vaccination. So I think it makes an unnecessary change. If you're looking for information in the information age, you will be able to go through it. If you're on Amazon looking for a pair of shoes, you're going to go through 8 or 10 pages sometimes to get to the pair of shoes. I mean, that's not the characterization that. I'm just saying that I don't believe that we need to legislate this. I believe that we could potentially work with the Department of Public Health to heighten this. Now that you've brought it to our attention, I don't think we need a legislative solution to that. We typically don't legislate where things are put on websites. We actually legislate that we put them on websites, and so it potentially, we're setting a precedent here that I'm not sure that I'm personally not comfortable with. So I appreciate the spirit in which this has come forward. We can certainly make the Department of Public Health more aware of this, and maybe they can make it a lot easier to search. But I'm going to recommend a no vote on the bill. So I'll ask the Madam Secretary to take the roll, please. So the motion it's been a while, due pass to appropriations.
Wood?
No.
Wood, no. Mainshine?
Aye.
Mainshine, aye. Bonilla? Burke?
Aye.
Burke, aye. Campos? Campos, no. Chu? Tababne? Tababne, aye. Gomez?
No.
Gomez, no. Hernandez? No. Hernandez, no. Lackey? Aye. Lackey, aye. Nazarian? No. Nazarian, no. Olson? Patterson? Aye. Patterson, aye. Ridley Thomas? Rodriguez? No. Rodriguez, no. Santiago? Steinnorth? Aye. Steinnorth, aye. Thurman? Waldron?
So a vote is 6-6, and that means we still have some members out there, 7 members floating around out in the ether. We hope at some point they come up. We're actually gaining members and losing witnesses at this point. So Mr. Gomez has a witness who's going to be leaving soon. We're going to give him the opportunity. While he's doing that, I'd like to call for a vote on the consent calendar while we still have a quorum. Madam Secretary, consent calendar includes items number 16, AB 2325 Bonilla, 24, AB 2589 Gomez, 27, AB 2750 Gomez, AB 2670 Hernandez, AB 2207 Wood, and AB 2889, a Health Committee bill. And I'm sorry, Wood has amendments, 2207 has amendments, Mr. Gomez, 2589 has amendments. I'd love to entertain a motion. So we have a motion and a second. Roll call vote, please.
Wood?
Aye.
Wood, aye. Mainshine? Mainshine, aye. Bonilla? Burke? Campos? Campos, aye. Chu? DeBobne? DeBobne, aye. Gomez?
Aye.
Gomez, aye. Hernandez? Hernandez, aye. Lackey? Lackey, aye. Nazarian? Olson? Patterson? Patterson, aye. Ridley Thomas?